Good evening and good to have you with us on the 9 p.m. edition of the Urban Debate. Viewers, not all heroes wear capes. In times of a pandemic, our real heroes, our true heroes are the ones who wear PPE kits and gloves and masks and work round the clock, work magic with their hands, with their medicines and drugs and equipment, risk their own lives, risk their own health, keep their family aside, and only think about saving lives. I'm talking about our doctors who've had the roughest of the times in the last 3 months, the doctors who are our frontline warriors. And for the past 3 months and more actually, since coronavirus hit the entire world, these are the people who've been working round the clock. Initially, there was no clarity on how to go about it. What would be the infrastructure needed? How would we prepare? How would we take precautions? And the cases just went on rising. Even now, you and I can perhaps be a little bit more relaxed. Our lockdown restrictions have been largely lifted. Things are beginning to change for us. We are beginning to step out of our homes, even if it is with masks and gloves. There is hope about a vaccine and a drug. But you know what? As far as our doctors and healthcare workers are concerned, things are not going to be easy for them anytime soon. Because coronavirus still exists and there isn't a vaccine. And so the cases will continue. People will keep getting infected. Some of them may get serious. But everybody would want to see a doctor. Everybody wants to run to a hospital the minute they fear that they may have been infected. And so their job doesn't get any easy for a long time. There isn't anybody to even replace them, give them a breather, become a substitute. There are only these many doctors that we have in our country, and it's a well-acknowledged fact that there is a large shortage. So viewers, just like all of those times where we got together as a country and said thank you to our COVID warriors, one more time tonight, Mirana wants to do that. And here on the Urban Debate, I want to do this on the National Doctors' Day. But not only are we going to say thank you, we are also going to talk to them about their experiences. Let us know our doctors. Let us know what they have gone through. Let's find out how tough it's been or how easy it's been. How have they evolved? How have their lives changed? Do they believe that post this pandemic, the way the medical fraternity works will be completely different? Have their lives been altered? Did they have the fear of getting infected in their minds? How did they tell themselves to not think about that and to continue with their work? So many questions. Today is the day where we give the platform to our COVID warriors and listen to them and hear their stories. I have a very special panel that I've put together for you. Let's say good evening to Dr. Sudarshan Ballal, Chairman for Manipal Hospitals. He's joining us this evening. He's President for Nat Health and member of the COVID-19 task
Tanvi.
force as well in Karnataka. So he's been working very closely. Thank you so much. He's been working very closely not only with COVID patients but also advising the government on what has to be done. Dr. Rahul Pandit, Director for Critical Care at Fortis Hospital in Mulund in Mumbai. He's also a member of the Maharashtra COVID Task Force. Again, a city that's been badly hit, and he has been at the front line there battling this for us. Dr. Iqbal Bagraswala is the Associate Director for Medical Affairs at the Saifi Hospital, again in Mumbai, the worst hit cities, working on the ground there, looking at how the patients are being treated, and it's been a long journey for him as well. Dr. Tushar Patel, pulmonologist and critical care specialist with Sterling and Carey Hospital in Ahmedabad, another of those metro cities that has seen a large number of cases in between. He's also a member of the Gujarat COVID Task Force. And Dr. Vijay Lakshmi, Senior Consultant for Infectious Diseases at Kaveri Hospital. She was made in charge of the COVID ward there and for the past several months has been leading that initiative. But first up, I actually want to go across to Randeep Guleria, the Director for AIIMS, one of the most reputed doctors, and he's been a prominent face not just in terms of treating patients and handling it on ground, but also advising governments on what the policies should be. So thank you to all of you, not just for joining us here on the Urban Debate tonight, but for everything that you and the entire fraternity has done for our country in the last many months. Dr. Guleria, let's begin with you. If I had to ask you for how has your life changed because of this pandemic? What would your answer be to that?
So I would say life has changed dramatically since the pandemic started. I have actually lost count of what the day is. We spend the whole day either looking after patients or planning how do we work on increasing our patient load, protecting healthcare workers, and it's been a huge challenge. And therefore, I'd like to take this opportunity to really wish all my fellow doctors a very, very happy Doctors' Day. I'd also like to say a few things, if I may. And the first few things is that although we doctors accept that there is a risk that comes as far as medicine is concerned, a risk that we will fall ill, and many of our colleagues have actually fallen ill before the pandemic, whether it be because of tuberculosis or other diseases, the risk gets magnified or becomes much more in a pandemic. And therefore, the fear and the other factors come in, and therefore, there is a huge need to really get everyone behind to support the doctor community when it comes to fighting a pandemic. And I think the few things that doctors would want is that actually everyone, including policymakers, administrators, listen to them. Those who are in the at the front line just want someone to listen to him and be reassure him that we're all there with you. Second, what they want is protect me so that I feel that I'm safe. Enough PPEs and health protection for healthcare workers is required. And then finally, prepare me so that I can be good as far as a warrior is concerned. And then care and support me and my family as I go in this fight against COVID. And that is where a lot of stigma has been attached to doctors and healthcare workers, which caused a huge problem in the beginning. I have, in my own family, things have changed dramatically because not only am I, but my wife is a doctor also, and she's working in a COVID area. My son is also a resident, and he is currently also working in a COVID area. So all three of us, when we come home, we have whole issues of social distancing and making sure that we are all safe and not giving the infection to each other. So this is happening in many homes where doctors, families are working, and I think this is a challenging time for us. And I think all of us have risen to the occasion as far as the pandemic is concerned.
Well, Dr. Guleria, when was the last time your entire family actually found time to sit together and have a conversation? Has that happened recently, since all of you are in this field and obviously extremely busy?
So, whenever for many weeks we had our meals with social distancing, and also had different rooms because all of us were working in a COVID area and we didn't want to expose each other. So, what I'm trying to say is that it's not only while you're working, but your own family infrastructure changes dramatically if because you are worried that you don't want to give the infection to anyone else in your family, and therefore you start taking all the precautions, whether it be removing your shoes when you come in, whether it be taking a bath as soon as you enter the house, or maintaining social distancing. Sometimes if you've had an exposure to a positive patient, you are extra careful in terms of seeing that you monitor yourself carefully and maintain the social distancing. Many of my colleagues who are working have actually gone into quarantine because they've had some exposure to a patient, and this is a stressful time for them because they're very worried that could they have got the infection and could it go on to their family.
Okay, fair enough. I mean, I can imagine how tough it would have been for everybody to constantly also keep taking these precautions, not just in the hospital, but once you come back home as well. Dr. Rahul Pandit, you've personally overseen treatment for over 100 patients. At one point, you also got infected. You had to go into a quarantine for 14 days. Did that experience change how you treated this entire process and how you treated your patients or interacted with them? Share a little bit with us.
Thank you very much for having me, and happy Doctors' Day, National Doctors' Day to all my colleagues and doctors all over India. Now, yes, it did. It did change my perspective completely. There is no question about that. But when this Corona cases started pouring in Mumbai, especially when the things started getting busier in the last week of March, I realized that we have to basically stand up as medical professionals to this challenge, because it's a once in a lifetime opportunity which we as medical professionals have to pick up ourselves and face it with chin up. During that, it was obvious that one of us or some of us may get infected. Unfortunately, it was me. And the 14 days of quarantine actually shows you the face of the patients as well as the doctors, and you are in a completely different side of the table, and you understand that what everybody is going through. So it actually made me probably a better person in terms of how the whole pandemic is basically affecting the patients, not just physically, but also mentally. Imagine sitting in that room there and not being able to see any faces, just people with mask and complete overalls. The overalls being coming to you and saying to you things, nice things many times, but you're not able to understand whether they're smiling behind the mask or not. So that facial contact, that visual contact is really missing out. Coming out of that, obviously there was no looking back. Mumbai has been really busy in the last 3 months that we've been seeing the COVID-19 cases. So we are back in full action. We've got patients coming up. We've got the ICUs running full. And in fact, we've opened up a few more beds now for the intensive care patients. So that's where we are currently. As far as the home front goes, I think it was a changing experience and a life-changing experience for my family as well. As Dr. Guleria mentioned, right from the start, we have been maintaining social distancing. My wife is also a doctor, so we always have this social distancing at home. Same, no dinners together, everybody eating in their own room, one person cooking for the house, and then hoping that we're not infecting each other. So those kind of things are going on the mind all the time. So that's where we are currently in the whole pandemic.
Okay. Okay, very interesting. Dr. Sudarshan Ballal, let me come to you next. Was this is something that you also noticed that, while even dealing with patients, the job becomes more difficult because you have to maintain your distance, you're any which ways overburdened with work and too many cases. You're also wearing a mask, so you're not able to directly converse and, interact in a normal fashion with the patients or even talking to their families. Did that become a big challenge?
At the outset, thank you very much for your kind, encouraging words and having me here on this Doctor's Day, and a happy Doctor's Day to all my distinguished panelists. Life has changed forever, I would think, since the COVID era for all of us. Especially for doctors, it's been a huge challenge. Not only taking care of patients at the hospital and in some of our cases administrative work, advisory work to the government, but also a significant change in the way you lead your family and lead your family life. So at the hospital, I think, at least in Karnataka, we sort of escaped the brunt of the COVID onslaught in the first couple of months. We are seeing it now, and the hospitals are absolutely full. There are no beds available, and we have had a long discussion today with the Honorable CM about how to increase the bed strength and also how to keep asymptomatic patients out of hospital. And certainly the way we examine patients, the way we see patients has changed. It's more of teleconsults, and even when you see the patients, you wear a mask, sometimes a visor, patient is kept at a distance. That doctors feel and touch, and to a large extent the doctor's smile has been replaced by computers and iPads. So I think the patients do tell me that, doctor, we would have loved to come and see you, have you examine me and see your smile. But that, I think, to a large extent is sort of not possible in many instances. And I certainly appreciate the tremendous brave work by all my colleagues who have been in the forefront of the COVID war. Unfortunately, many of them are down and some of them have been very sick, including being in the ICU. So it's a very challenging times. So I think as doctors, we are meant to take care of people who are not well, whether it's COVID, whether it's H1N1, TB or whatever. So I think we should not shirk away from the responsibilities, but at the same time, take enough precautions to make sure you don't get ill, because it's necessary that the healthcare workers remain healthy, because otherwise the health system will collapse. And on the home front, I think, of course, we are a family of doctors. My son is doing his MCH in oncosurgery at Tata Memorial in Mumbai. And as you're aware, Mumbai has been hit very hard, so he's extremely busy and we don't get to see him even on a WhatsApp call or a regular call. So he's doing his job. My son-in-law is a pediatric cardiac intensivist, so he's also quite busy with taking care of young kids at the hospital that he's working in. So, and of course, we have some lovely grandchildren, daughters, and my wife at home. So, as far as possible, we try to stay away from each other, and certainly are extremely careful about any symptoms. And we also try to keep a distance among the people who are the other people who are in the house, be it help, drivers, or our security people. We try to keep a social distance. So it's not the good old self. And certainly we miss our outings together on a weekend with the dinner at some hotel, and mostly our movie outings on a Sunday. So now that's replaced by Netflix and Sony Live, so on and so forth. So life has changed, and I think this change will be forever. But I believe that like any other pandemic, this too shall pass, and we'll come back to the new normal in the next few months.
You know, I must say this to all of you that when coronavirus had initially hit us, and I mean, I'm not talking about January or February when we were still talking about what's going on in China, but when by mid-March it had become a reality for us, and we had started talking about social distancing, a term and phrase that was new to almost everybody at that point of time. And I used to have, experts on our panel who would say, well, this is going to be our life for at least 6 months, if not the entire year. And it would be so difficult to imagine that. And this is even before the lockdown. I know of our viewers and, many people who watch that who still wouldn't understand, what the ramifications of what we were saying to have that kind of a lifestyle for months together, for an entire year, to stay away and not do all these normal things. I think people are still coming to terms to it. But Dr. Vijay Lakshmi, I think what makes it even more challenging for the medical fraternity, for all of you doctors, is not only does that part of your life change, but also your work changes. How you, conduct yourself at work, how you deal with the patients, how you actually go about your entire routine, that also significantly changes. Tell us a bit about that.
Life changed completely after the corona pandemic. Like, they were all talking about a doctor's family. I come from a totally non-medical background, and my son is 1.5 years old. So it is impossible to have social distancing at home. My parents are 70, so no choice. But I can tell you, I'm fairly sure that I will not get corona from any of my patients, because I'm an ID person, so we are used to all these masks, these aprons and stuff. That's been part of our life for a long time. But what is a mega problem is non-medical areas. The non-COVID areas, you have people coming in and going. And you're worried about the water, you're worried about when you're going around. And that's one thing which we don't really have control about. So in fact, I carry food for my juniors. So we're very careful about our food. We're very careful about people coming in the non-COVID areas, because that's where caution is low. And that's where the chance of getting it is much higher. So quarantining, making physical distance, making them using the lift, everything is checked. And to be frank, majority of my work involves around that. So we end up seeing around 40-50 COVID patients every day. But the other part of the day goes off in controlling these things. And unless the overall infection rate among the health fraternity is low, you cannot run a hospital. And that's where the real problem comes. The way you look at this infection itself changed completely. So every day starts with me finding out whether anybody is sick. Everything is routine is followed. Like, you put a pathway. The pathway has to be complete. The lift has to be the same. The way they walk around has to be good. The canteen has to be secure. The food delivery system has to be perfect. It's umpteen number of checklists. So apart from patients, this occupies quite a bit of time. And to add it, I just want to thank
very interesting, and I can imagine the challenge. Go ahead, please. Yes.
I just want to add today, I just want to thank all the non-medical people, the nurses, the housekeeping, the paramedical staff, the administrative staff, who just make us what we are today. On Doctors' Day Eve, not just thanking all the doctors, I want to thank all the non-medical and paramedical people who made this COVID journey a successful one.
Okay, I understand what you're saying, and I will want to join that in saying yes, a big thank you, I think, to the entire healthcare professional industry. Of course, today we are focusing more on doctors because it's National Doctors' Day. Dr. Guleria is just with us for a short bit, but before he leaves, I just wanted to ask him one more question. Dr. Guleria, one message that you would have for people from the medical fraternity, the ones who are working round the clock to save us and to ensure that we remain healthy, what would your message be to the people who are watching this show tonight for the coming months in this war against corona?
So I have two broad messages. One message is that please follow social distancing, wear a mask when you're out, and be careful. This war can be won not in hospitals but in the community. And if the community people, everyone participates in breaking the chain of transmission or preventing the spread of infection by social distancing, wearing a mask, hand washing, not forming a crowd, I'm sure the cases will come down. And the second thing is that on Doctors' Day, I would like to say that please respect and see what the doctors are going through. Don't have a stigma against the healthcare professionals. Try and support them because they are actually putting not only their life but the life of their loved ones at stake to really fight this war. And therefore, you should support them in whatever way you can. Those are the two messages I would like to give.
Well, thank you so much, and thank you once again for being with us on this conversation. I will actually take up that point and go across to Dr. Bagasrawala. Dr. Bagasrawala, the stigma that gets attached to this disease, the kind of reaction, the mindset that we saw in many parts from the society towards the doctors was also a little unnerving, and of course, it played a big part on the mindset of the doctors. How did you deal with this? Did you have to speak to your own team, your own healthcare workers, and tell them to not get bothered by it or not get bogged down with it because somebody there in their society was targeting them or harassing them, or people were beginning to stigmatize them because of this disease?
Thank you, Tanvi. At the onset, let me tell you that 40 years into practice, I think this is the first time in my life that we've seen a problem of this magnitude hit the medical profession and take us unawares in this manner, where all of us had to change gears, change the way we worked, change the way we thought, bring about major changes in a very short span of time to cope up with the new ways we had to tackle this. I think for the first time in my life, I realized the agony that a service officer's family goes through when the gentleman in the Army, Air Force, or Navy goes to war. For us doctors, believe me, the story was the same. The only difference was that we were going to war every day of our life. And we were worried every day of our life whether the bulletproof vests that we were wearing, the PPEs, were they going to be good enough for us to be protected from this unknown enemy, which was hitting like a sniper shooter from the side. You never knew where the bullet was coming from, and you need to make sure that you were safe. And every day when we went home, we were worried that we hope we were not infected and sharing that infection with our family. In Mumbai, at least, all of us live in houses which are not very huge. So whatever social distancing we talk about, I think to a certain extent, by and large, we have noticed that if one member of the family got infected, the entire family, by and large, got infected. So on that opening note, you will realize that a lot of doctors who were on the front lines, because of the way we were handling the problem initially, because we didn't know exactly how the whole problem was presenting itself, some of us did get infected. And then we needed to make sure that the doctors were quarantined. It was an absolutely new necessity as an institutional handler that a lot of our workers didn't want to go home. They were willing to come to work provided we provided them with facilities to stay. And for the very same reason that you're asking this question, that what would happen, will their society allow them to come inside? And if they did come inside, will they allow them to come outside again? And that was the truth of the matter. Despite all directives given by the corporation, the police force, the government, the local societies in their own ways, because they were as scared as the vast population. They were as scared. Let's not blame everybody on this, because they were worried what happens if a doctor brings the problem, or if a nurse brings the problem, or a housekeeping staff brings the problem to the society. Everybody was worried. And therefore, the greatest challenge we had to face was to provide accommodation to a fair number of people who were worried. They had small children at home, they had elderly parents at home. And I think we need to give a lot of thank you to a lot of lodges and all which were closed down, who voluntarily came forward and offered their premises without any cost. And I must use this opportunity to thank all of them. And they're still continuing to house our people. And I think they need to be complimented. I think there are a lot of unknown warriors that have participated in this great war that we fought against COVID. And I think we need to take credence of all of this. Of course, I would put a special thank you to my resident doctors. They're young, budding doctors. They come to my institution to learn postgraduate training.
Yes.
And all of them, even if he's working in radiology, he's working in a COVID ward, he's working in a pathology, he's working in a COVID ward, he may be a surgeon who's working in a COVID ward. Nobody has been spared. And salutes to all of them. And salutes to the nurses, because they are the ones who are there around the clock. Consultants like us walk in, they're there for a short time, give them guidance, then telephonic management, but they were the real frontline workers. And I think salutes to all those doctors, all those nurses, and in particular, our class 4, class 3, the housekeeping staff,
Correct.
the people who run your kitchen, everybody. I think nobody has contributed in any little manner. Each one has done his job beautifully. And I think full marks and compliments to all of them. I certainly would like to take this opportunity to thank the government institutions, the management, the BMCs. And I think we have at times had to write letters to societies that, look, these people who work with us are in the essential services. And please, they are working with us in the hospital, and please permit them to come to work. And please permit them to go to their houses safely every day.
Well, I must say that I think while initially there have been quite a few problems across the country, at least our governments have been receptive about it. And perhaps for the same reason that for everybody this was an unprecedented crisis, nobody really had a plan in place to say, oh, this is what you have to automatically do if something like this happens to your country. And we are all learning as we go forward. Of course, the pressure is more on the doctors and the learnings are perhaps more crucial for the doctors. So, Dr. Tushar Patel, as you make your opening comments as well, that one story, that one big, maybe a moment or a learning from the past 3 months that you may want to share with us.
First of all, I would like to thanks to the all frontline warriors, our doctors, paramedics, and also media people who make awareness regarding this disease, pandemic disease to the all over country. Also, police staff, those who are tremendously work in this lockdown period. So I salute to all these people, paramedics, doctors, and nursing staffs, and all these things. And this pandemic, this is, I say, a new life. This is our newer life. I say this type of new life because this coronavirus changed the all people life like hell. Like they are changing all the scenario in all the day-to-day work and all this place. And this coronavirus also make changes like in all our day-to-day works. We are working in the private setups, and also we start working in government setup. Also, we with the help of the chief ministers of our Gujarat, because in our Gujarat there are very worse conditions in the Ahmedabad only, and there are our chief minister request to the all the private doctors, and we are groups of private doctors in Indian Society of Critical Care Medicine goes to our civil hospital and SPP hospital in our city. We help to the doctors, critical care specialists, because in our hospital there are some crisis of the critical care specialists in that our city. So we start in our in April month, start in the round to our government hospital in do works for the day and out.
Okay. I want to just say that if anybody can remember a specific moment or a story that you want to share, please go ahead. I want to also make this a conversation between the doctors about how the last 3 months have been. But also, going forward, Dr. Pandit, maybe we can begin with you. Does it ever concern you that it's been so long, week after week, day after day? I'm sure that there are times when you feel exhausted, but you can't stop now, and you don't even know when you will get to. You don't know when you will get that break because the cases are still high. We still don't have a vaccination, and the minute people step out, you will see a spike in the number of patients as well. Does it concern you that this will go on for a long time and you're not going to be getting any break at all?
So concern may not be the right thing, but yes, it does physically exhaust everybody. So the whole team has been working for more than 13, 14 weeks now. And it has been day after day, without any weekends, without any night off. On an average night, I get around 5 phone calls now. And then they have to rush into the hospital once in a week or two. And that basically, just puts you up on the edge all the time. You are always on your guard. But how long can you keep on going like this? That's the big question. But the thing is that right now there is no time to think about it. You have to, as I said before, you have to face it with chin up. You have to be prepared that this is going to be a long drawn battle. You have to conserve your staff, your energies in such a way that you distribute it equally. The workload gets distributed between your workforce in a reasonable way. Try and use the technology to your advantage. Appreciate that the things which were basically being done without the PPE in the ICU, now with the PPE in the ICUs, the efficiency is going to go down by 10 or 20%. Time your things accordingly. So those are the small corrections which we have to do. I would say this is the new normal, and I just don't see that where is the end of this new normal going to come. Let's say by God's grace or some miracle, this thing stops in a few days' time or a few months' time or a week's time. We are still going to keep up with the guard for several weeks to come up. So it's not something which is going to go down very quickly. So I think we need to really tighten our belts and keep on moving in the same way that we have been doing for the last 13 or 14 weeks. Now, you're talking about the miracle or the small stories which sort of change up your perspective. There are several of them. We see a lot of them who we had lost hopes, but somehow they sort of gradually improve and then come out of it. The old people whom the mortality or the morbidity seems to be really high, they tend to sort of take some time to recover, but they turn around. And yes, we are not able to save some of the patients. That's the unfortunate reality of the pandemic and a disease. But trust me, every healthcare worker, whether it's doctor or non-doctor, puts in their more than 100%, and it has been going on for the last 13, 14 weeks. And I don't know how long we are going to continue with that. So my only message for that is keep moving forward, tighten your belts and be positive about it. That one day all this will settle down, and one day the new normal will cease to exist and you will go back to your good old days.
Yes, and I think there is no other way but to see it with a little bit of optimism, to say that, yeah, right now this is what you have to do, but someday there will be a vaccine and things will subside. But I raise this issue because I often sit and think about it, that for how long, for the first few months, Dr. Vijay Lakshmi, we shut down, most of the other medical treatment operations, the non-essential part of the medical operations in any hospital. But you can't put it off forever. Gradually, the other patients, the other diseases, surgeries, at some point, they too will have to start. Does that play on your mind that, today we are doing this and we are fighting this for the next couple of months, but soon that load will also come on us. And somewhere you will have to figure how to balance it all, because there are only so many of you. We're not getting any new doctors overnight from anywhere.
It's already started, because the lockdown started pretty early. It's almost 3 months now. So you can't put away a cardiac emergency for a long time. You can't put away your fractures. So all those which were considered semi-emergency, non-emergency has become an emergency now. So as of now, we are working. We have both COVID area and non-COVID area. Both have to be separate and are functioning independently. And as long as you make sure infection control is perfect, things do not have a problem. Only thing is your load becomes higher, especially for, very few doctors are there. Junior doctors are less. So amount of work we do becomes double, and I think we don't have a choice. Ultimately, it's work. You get used to it.
Dr. Ballal, would you like to comment on this aspect as well?
Absolutely, Tanvi. In fact, you stole the words from me. This is one of the serious problems I've seen in the COVID era. No other pandemic have we seen that patients who have diseases other than the pandemic have suffered as much. Many of my patients, I'm a nephrologist, require dialysis 3 times a week, without which they will die. So even those patients were finding it difficult to come to the hospital. There are a lot of cancer patients, transplant patients, cardiac patients, and they are unable to come to the hospital for multiple reasons. One is, of course, during the initial lockdown, travel was a problem, and interstate travel is again a problem even now. The second aspect is that they were afraid to come to the hospital. There was this stigma attached to corona. So if there is a corona patient in the hospital, no one wants to come there, even for an elective or, for that matter, a semi-emergent situation. Only the dire emergencies would come. So my sincere request to you and the media is to remove the stigmatization of COVID. You know, if you get into an apartment complex, if there's some COVID in any apartment, they shun them like pariahs. And the second thing is that there's a tremendous fear psychosis of COVID. We need to have awareness, we need to take measures to prevent it, but I think fear psychosis is something we should get rid of, and all of us should work together in that direction. And interesting story I had was that one of my very senior colleagues and his wife went for a vacation to Athens and London just when the COVID started, and the day they came back, they got admitted to the hospital with a cold and cough. And then the wife became very sick, had to have ICU stay, and of course the gentleman was also quite sick. So this was the first serious case of COVID we saw, which happened to be my colleague. Fortunately, both of them have been discharged safe, and he has volunteered to be a plasma donor in case the plasma therapy is needed for anyone. This was sort of a happy ending in this gloomy situation.
Oh, that's really good, and thank you so much for sharing that story as well. I mean, I think some positive stories are also needed in all of this gloom that we are also constantly, talking about and reporting. And I know what you're saying about, the fear and the stigma, Dr. Ballal. I think it's not just the healthcare workers, obviously a lot more for you all, but even anybody else who's in the essential services or who's out there doing their job, including some of our reporters. It's the same. The response that you see from many of those living in these societies and complexes, and I get that their response also comes from a sense of fear that if we get another case in our building will shut down tomorrow, or we will be in our containment zone, we won't be able to move around, we may get infected. But yes, it has become a big problem, especially for the medical fraternity. Dr. Ballal, any interesting insight or story that you would like to share with us? You come from a city that's been one of the worst hit. I think Delhi only recently managed to match up and catch up with Mumbai as far as cases are concerned. So Mumbai has had it tough right from the start, and it will take some time before things begin to ease.
Tanvi, let me share that Saifi Hospital where I work had the honor of being the first institution to be converted into COVID hospital as a full hospital. And we started with about 30, 40, 70, up to 100 beds. That is what our bed strength today is. We had a policy of not allowing relatives inside the COVID ward. For the simple reason is the fear was that we might extend the illness to others. And that was a big responsibility that we took on our heads, because we took the responsibility of the patient care entirely on our own. And patients would come hale and hearty, and while they were still with us, they would go downhill, and some of them would deteriorate, and some of them may even go. And that became an extremely difficult position for us to be able to explain to the relatives that, look, my patient came in walking and now he's on a deathbed. So we had to create communication lines, video conferencing, sharing the patient's condition on a day-to-day basis, maybe once a day, twice a day, with one contact in the family to make sure that communication and the information that the relatives wanted was intact. And I think that has helped us a great deal in patients accepting this very difficult situation. Now, in the process, you will have to understand that a healthcare worker who looks after and takes responsibility of such a patient to a certain extent might get emotionally attached to that care of that patient. And there would be times that we would have a 45-year-old who would walk in and go downhill and lose his life. And then sometimes we would have the pleasure of a 95-year-old coming in and walking out of the hospital hale and hearty. And I think that would be the thing that would drive us, that there is still hope. Age is not a constraint. It's a biological age we are looking at. There are enough people with good immunity irrespective of their ages. And that was the driver that kept us going. And I think we've had a fair number of people who recovered. And today we are very, very happy, and they are very, very happy and thankful to the institution for doing what we did for them. Yes, in the process, there might have been a few hiccups with some. There might be happiness with others. But I think that we have to accept in our stride. Now, on the other side, the non-COVID patients, yes, the pressure was all the time because we were kind of informed that for the time being, you will be only COVID. Then subsequently, the rules were relaxing, now emergencies only. And our physical layout of the hospital, we were very fortunate that we had three kind of entrances, 3 sets of lifts. And therefore, we could segregate the non-COVID from the COVID very, very easily. And I'm very happy and proud to say that as of today, we have 97 COVID versus 47 non-COVID, who are all coming with different kinds of problems like stroke, heart attacks, fractures, surgeries that require urgent exploration. I think just yesterday we had an intestinal perforation that was operated in the middle of the night. And I think one area that has always been pressurizing us is our maternity section. The women come pregnant, some come in an emergency for emergency labor, women who are registered with us, women who are not registered with us, they don't have a gynecologist on our panel. They'll end up on our doorstep, almost in labor, and we have no choice about their COVID status. Irrespective of that, the hospital has risen and made sure that the care is offered. I think kudos to all those people who have taken the risk, not knowing the COVID status, delivered those lovely babies, taken care of the babies, taken care of the mothers, and all we have done is reduce the length of stay as far as possible to as less as possible. Yes, initially we did have a lot of resistance because ladies didn't want to come without their mother-in-laws or their mothers for delivery. So subsequently we had to relax on one condition, that you enter the room, you don't come out of your room till you go out of the hospital. And I think all those new norms that we learned to put into place has helped us deliver a comprehensive, total care across the board in our hospital. And I need to thank everybody who has participated and guided us in doing this and achieving this great objective.
Thank you so much for that. If I can just carry forward this conversation and go across to Dr. Tushar Patel. Dr. Patel, the other big thing, of course, is also the fact that doctors themselves are are getting exposed to the infection. Whether you are in the COVID ward or not COVID ward, you don't know if your next patient is infected, and every procedure has to be, or every treatment or every interaction has to be done in that utmost precautious manner. How do you keep the morale of your team high? How do you tell those who are in your ward, how do you tell your doctors who have to come in, day out and do this, to not get bogged down, to not get stressed? How have you managed to keep your team together? In fact, from Gujarat, we also had a few visuals where doctors were not only taking care of the patients, they were also, keeping their morale up. There was a lot of singing and dancing that was also happening in a couple of wards just to keep the patients also, a little happy and smiling. How do you go about doing that?
Yeah, in the most of this time, these are mostly doctor are affected mostly in non-COVID area is more doctor than COVID area, because in COVID area doctors are keeping up all these things. They are doing a proper donning, doffing, and all these procedures are also doing properly. But in non-COVID area, they are not doing a proper donning, doffing, and all these things. In also we are keeping our all doctors. We are keeping our yoga and pranayam also, and like in our Gujarat, we are doing all doctors. They are singing also garbas with patients. So we keep happy to the patients to keeping doing a garba with patients and all these things. This is this type of activity we are doing with doctors and all our paramedical staff to keep happy and stress free, because this is not a pandemic, this is a pandemic. This pandemic condition, all are worried and afraid about this disease. So we are keep all the people happy, and stress free. Another thing I tell you regarding the story, our doctor association in Ahmedabad Medical Association and our physician association are doing in different area. We are because in Ahmedabad is the worst condition to the regarding the bed. So we are starting we suggest to the government to task force to home isolations, and we are promoting to the home isolation. ICMR guidelines also promoting the home isolations. And at that time, our doctor association different zone in Ahmedabad, different zone, with help of Ahmedabad Municipal Corporation and Government of Gujarat, with help different area, they are taking general practitioner and physician, taken all the patient, home isolated patient, 3 to 4 patient, one doctor's taking teleconsultations. If required, home consultations is also doing. So in Ahmedabad, nowadays you a change of scenario you see. The earlier there are the early into the April and May, there are worse conditions. Now in the June, end of the June, there are condition is improving, quite bit improving into the hospitals and beds and all these things. Due to the all association, public and private partnership, great help to the government and also a public regarding the beds and treatment in the Ahmedabad.
Dr. Ballal, would you also want to comment on this? Because, it's not just about treatment of the patients. You have to keep the morale high of the patients. You also have to keep the morale high of your own staff, your own doctors, who are there in the middle of all of this gloom constantly day in, day out. Dr. Sudarshan Ballal, I think we've lost the audio line with you. I'm just going to come back, to you on that comment as well and on that question. Maybe Dr. Pandit, you can also come in on this aspect, because I think that's also one of the biggest challenges for doctors today.
Absolutely. To keep a team together, that especially working in intensive care, is a very, very big challenge. It is about short shifts in terms of the time frame which we are doing now. And one of the things which we need to do is that make sure that they are safe and they are given enough rest. So for a typical ICU right now, we are doing somewhere between 6 to 8 hour shift for our doctors. That does mean that what ICU I was running with, say 4 doctors, now I need 6 or 8 doctors to run that. So you need to make sure that they have got enough rest in between the 2 shifts. They are having given the right personal protective equipment. You need to keep on talking with them, interacting with them, try and understand what ground level problems they are facing, because they are spending a long time inside the ICU, at least 6 or 8 hours at a stretch. You also need to make sure that in their off time, they have enough and proper space to stay, which is nice and comfortable, and the food which they have been given there is also very good, because that all is going to basically ultimately the nourishment, the nutrition, everything is going to make sure that their morale is going to be up and they will feel like coming back to the work. It is also important that we understand their needs. Some of them may have genuine problems to go on leave. So while the system is stretched, many times when a doctor comes and asks for a leave, believe me, it is because they were genuinely required to go for some work, and that's why they're trying to skip work. No doctor have I come across in the intensive care now in my team who has actually come and said that I need to take a leave because I'm tired. None of them have said that. But genuine, they have parents, they have old parents to stay, to sort of look after. Sometimes the family emergencies are there. So we need to look at all of these aspects. And that's what the morale keeps up going. And that's what they basically understand, that yes, at workplace, I am treasured. I am given importance. And once you start having that kind of a feel, I think that the whole teamwork comes into play and the team stays together.
Okay, final comments from Dr. Ballal. I believe we have his audio back. Go ahead, please.
Yeah, that's a very important point you raise, Tanvi, because not only have the doctors to take care of the patients, but they also have to take care of themselves and the family. And when I say doctors, it also means the valiant nurses, the paramedical staff, the ambulance drivers, so on and so forth. So we have to make sure that one, they are safe in the environment that they're working in. We have to provide them enough PPEs and other measures that are needed to be taken. We have to have enough staffing where they are not overworked, and also if one of them falls sick, there's someone else to take care of that. And we should have constant interactions with them to boost their morale, because especially if a colleague of yours falls ill, then there is a pall of gloom across the hospital, and that's the time that we have to interact more. And also we have to keep in touch with their families, because a lot of families are concerned that my husband is working in the ICU, pulmonary medicine or ER, and is taking the brunt of this. So I think we have to have an interaction with all concerned, keep up the morale of the healthcare workers, at the same time give confidence to the patients that it is safe to visit the hospital even for a non-COVID illness. We don't want non-COVID illness patients to die at home because they don't seek attention. So I think it's very important to make sure that they feel safe coming to the hospital and the doctors feel safe working in the hospital.
Okay, thank you so much. And I think that was an extremely important point that all of you addressed. And the fact that going forward, these things will have to continue because we are in it for the long haul. And I think on our part, what people can do is not harass or target or stigmatize or isolate those who are working in the healthcare fraternity, because they are doing the most difficult part of the job right now, viewers. All we have to do is take precautions, maintain our distance, stay indoors as much as we can, and take care of our own health. The bigger challenge is for our doctors. They've been doing it non-stop, round the clock, without complaining, without taking a break, without thinking about their families or themselves, their own health for the past 3 months. And they will have to continue doing this for many, many more months. Things are even more difficult when you talk about the government hospitals, where they are extremely under pressure, overburdened, understaffed, and the cases just continue to roll in. So spare a minute for all of these people who are actually doing us a service and putting their own health at risk. A big thank you to all of the doctors who joined us. We got you doctors from the worst hit cities with the stories from their experience of the past 3 months, just to get a sense of how their life has been, how it's changed forever, and how they see the way forward from here. Of course, this was just one small conversation. I think we need to have a lot more about how the healthcare fraternity is also dealing with it, including the impact on their own mental health because of this pandemic. Thank you so much for joining us on this special conversation.